Thank you to everyone who joined today's live stream. Please check the settings on your screen in case you're having any audio issues, and we will get started in about 30 seconds. Thank you once again for everyone joining us. Here is Bob Gallo with AARP.
Thank you, Brian, and good afternoon. I am AARP Illinois State Director Bob Gallo. Thank you for joining us today, and I want to welcome you to this important discussion about COVID-19. AARP is a nonprofit, nonpartisan membership organization, and has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. We are so happy to collaborate with the Chicago Sun-Times to bring together this amazing event today. First, I think we are all grateful that 2020 is in the rearview mirror. COVID, of course, is still with us and will be for some time. 2021 has held the promise of broad vaccine distribution across the country. Yet halfway through the year, major challenges remain. The virus has mutated, and continued outbreaks nationwide show just how difficult prevention efforts can be. While vaccines are here, distribution has had some challenges, and many Americans continue to feel the emotional and financial hardship from the pandemic and fears about what is to come. Today, we're looking ahead, and I'm pleased to welcome our Illinois top doctors to have this conversation together about where we are and where we go from here. Please welcome Illinois Department of Public Health Director, Dr. Ngozi Ezike, and Chicago Commissioner of the Chicago Department of Public Health, Dr. Allison Already. Welcome to you both. It's wonderful to see you, and thank you for being here with us. Dr. Ezike? You're on mute, I'm sorry.
Apologies. Good afternoon, and thank you, Director Gallo and the entire AARP for the opportunity to join you for today's conversation. We need to share, our progress as a state and what we're seeing as we move forward. We are very fortunate that so many people in Illinois have heeded that important call to get vaccinated and are exercising caution in their daily activities. Of course, with nearly 6 million Illinoisans fully vaccinated, that's over 55%. We know that there's still a long way to go when you think about a state of almost 13 million. But I really want to commend and lift up the AARP audience, because in the 65 and older category, we have seen 1.6 million, or nearly 80% of people fully vaccinated. And when you think about people who've gotten the first shot, and we know that most of those people go on to get their second shot, we've got 84% with at least that first shot. So these numbers are super important, especially as we think about the presence of the Delta variant in our state, and even higher Delta variant incidence in states around us. And we need to think about all the steps that we can take to fight it. We know that the more people that have been fully vaccinated, as that number continues to grow, the less chance this virus or any of the variants that follow will have of infecting our Illinois residents. And the sooner we can get back to the routines that we are accustomed to, seeing our friends and family, spending time with our precious children and grandchildren, the happier we will all be. So thank you for the partnership, AARP and the AARP audience, for doing what we needed to do and for looking for ways to continue to advance these important efforts. Thank you.
Thank you, Dr. Ezike. Dr. Already, any opening thoughts from you?
Yeah, let me just echo the thanks to AARP and the Chicago Sun-Times. We love any opportunity to get together and answer questions. I think where there are people who have still perhaps not made that decision to get vaccinated, our goal is always just to share what we know and hopefully help you feel more confident in that decision. I will note here in Chicago, especially where we're thinking about the population over 65, it's actually an area that we are lagging a little bit behind the rest of the state. We are ahead broadly, sort of where you compare nationally in working age adults. We're ahead in frontline workers. We're doing well overall as a city, but you heard, we're relatively high across the state, whereas here in Chicago, still not even 3/4 of people over 65 have gotten that first dose of vaccine, and we're even a little behind that. It is the most vaccinated group, to be sure, but I do just want to highlight that as we talk about this Delta and the rest sort of looking ahead, we think very differently about the risks for people who are vaccinated and people who are unvaccinated. And that's what I hope we'll get into with the questions here. So where people are fully vaccinated, the risk is not zero, but we think about the risk to those people in really different ways than folks who have not yet made that decision to get vaccinated.
Great, thanks. Maybe we can a little bit more into that in a little detail. We've come a long way, obviously, since vaccinations have been available. And it's good to hear that, we're doing better. We could be doing better everywhere, including, as you said, Dr. Already, in the city of Chicago. Let's talk about the Delta variant, which is now responsible for about 1 in every 4 infections in the United States, according to the CDC. Can you explain to our listeners, what is this Delta variant all about? And in addition, are the symptoms any different comparably? Dr. Zike, if you'd like to start with that.
Sure. So what we know is that viruses mutate. They do change. They're trying to promote their continued existence. So if they can get an advantage by changing just a little bit, that might give them the edge to maybe be more infectious and therefore live on in more people, maybe cause more illness. This virus is doing what viruses do in terms of the mutation. So we have seen multiple variants that have been circulating around the world. And we also know that all of these viruses, all of these variants, they're only a train, plane, bus ride, car ride away. So anywhere in the world that these variants occur, they can come they can travel to all parts of the world. What we're seeing with the Delta variant, I know we talked a lot about the B.1.1.7 variant that was first identified in the UK. We see that this Delta variant has properties similar to the B.1.1.7 variant in terms of how transmissible it is, how easily it can spread to other people. And so just by the very nature of it being able to spread so much more efficiently, that means that anytime there's a large gathering, particularly of unvaccinated, unmasked individuals, should there be 1 or 2 people carrying that infectious virus, it can spread to so many people so efficiently and so quickly that you get these quick outbreaks of many people at a time because it's so easily transmissible. And so that's why we have seen, just since the 4th of July weekend, when there would have been a lot of gatherings with lots of people, that we have seen almost 5,000 new cases just since then. But again, the same things work in terms of the vaccines do work and masking does work. And so those are still important tools that we need to avail ourselves of.
Okay, thank you. Dr. Already, let's keep talking about this. The New York Times has tokened this Delta variant as super contagious, which has prompted lockdowns around the world. Is the Delta variant more contagious and dangerous in Illinois, particularly a city like Chicago, where we all live in close proximity to each other? And can you explain more about it? And if someone is vaccinated, do they need to worry about the Delta variant as well?
Sure. So I would say the Delta variant is just one of what has already been a long string of variants and is going to continue to be variants. Viruses always mutate and have variants within them. But the concern with the Delta variant is that it is, as Dr. Ezike said, it is so much more contagious, at least 50% more than the Alpha one, which itself was 50% more contagious than the original one. And so your risk at this point is quite split around whether you're vaccinated, but also what it actually means in practice is that you don't need as much exposure to the virus, right? And it is more easily spread. So where we think about what are the pieces, it doesn't show up differently in terms of symptoms. It doesn't show up differently in terms of who is at greatest risk for getting in the hospital. But when you've got something that is that much more contagious, what we've seen here in Chicago, 97% of the folks going all the way back to January, 97% of the people who are hospitalized and 97% of the people who have died are unvaccinated. And really the difference has not really been whether they had the Delta variant, it's about whether they got COVID. It's just that now with the Delta variant, there are more people, more opportunities to get COVID.
I see. And so, to just kind of follow up on that, I had the Moderna vaccine. Other people might have had the Pfizer and some might have had the Johnson & Johnson. And there are some more on the horizon as well that are being considered. Are any of the current vaccines, is there a difference in their clinical effectiveness against the Delta virus? Either one of you?
So what we know now is that our vaccines are highly effective against all the circulating variants, where we have lots of data, on the mRNA vaccines, because there have been many more, orders of magnitude more doses of those vaccines that have been given, not just in the United States, but around the world. But what the data is very clearly showing us is that these vaccines are effective. So we want people to get vaccinated. That is their very, very best option. And we know that there are 2 doses of the mRNA vaccines, the Moderna and the Pfizer, and there's 1 dose of the Johnson & Johnson vaccine. And as of now, the CDC is saying there is no need for an additional dose at this time. They're watching the data intently, and they'll let us know if there's any sign that information is outdated and that there's a need for any change in the plan.
I see.
And I would just add one other piece to that, is that it is important that people get that second dose if they didn't of the Pfizer or the Moderna. There was a big study out of the UK that was all about the Delta virus. And what we saw was that if people had gotten both doses of Pfizer, and you would the same approximately with Moderna, that the level of protection, there was a little bit of a drop, right? We went from about a 93, 94% protection with the original to with the Delta, it was about 88%. That's still a fantastically protective vaccine, but in people who had only had the first dose, it was down more in like the 50% range. So it is important that you get your full vaccination. But if you've gotten both of Pfizer, both of Moderna, or you're one of J&J, you do not need to get another one at this point. And that has been, that's been studied across all 3 of the vaccines that we are using here in the US at this point.
Okay, so thank you. And, we've, as you both stated, vaccination rates are in pretty good shape, but we need to go further. But fall is coming. So we know that's traditional flu season. Is there any possibility of a surge of the coronavirus itself? And also the fact that what I read in the news just yesterday was that Los Angeles has gone back to mandating masks indoors or around large groups of people. What do you foresee for the fall in Chicago and Illinois?
Sure, I can start because LA was at the city level. So Los Angeles is having more than 1,000 cases a day again of COVID. They are having a real surge, and most of that is Delta, and it is very, very heavily in unvaccinated people. And it is important just to note that in addition to cases, we are seeing increases in hospitalizations too. Now, where I think to the fall, already we are seeing some increase, right? We remain in very good control right now against COVID here in Chicago with positivity and number rates that we would have loved to see a year ago, but they are on the way up. And I do expect that as we move into the fall season, we will probably see some more increase in these cases. What's going to be different is that these cases are so much more heavily going to fall on what we call unvaccinated networks, where there are groups of people or particular settings or even neighborhoods that are less vaccinated. And so we're doing a lot of thinking and preparing for what that likely surge will be, because COVID is largely, not entirely, but largely what we call a vaccine preventable disease now. So we are already planning for, for always, we've thought about pneumonia and influenza kind of as that season. We're just thinking about PIC, pneumonia, influenza, and COVID. And we're not going to eliminate COVID. It's going to be part of what happens moving forward. And I do think that we are likely to see more cases as the months move ahead. But I don't think we're going to be at a point right now to be saying everybody needs to be wearing masking. That's a local decision based on what local surging, is looking like. And right now we're in good shape, but we'll see how things are later.
Dr. Ezike, anywhere outside of Chicago that you see particular concerns in areas where the vaccination rate needs to be stepped up?
Yeah, no, we have great numbers as a state, but it's not evenly distributed across all counties and across all regions of the state. So whereas the Northeast, Chicago, Cook County, and the surrounding Collier counties have some of the highest vaccination rates, we have many counties that are very low in Southern Illinois, in the Metro East area, even in many counties surrounding Sangamon County, where Springfield is. And so we are not surprisingly seeing an increase in those areas in terms of the numbers, not just of cases, but the numbers of individuals going into the hospital. So we're seeing a rise in hospital admissions, which is tied to low rates of vaccination in those areas. So some of that surge we are already experiencing. We have a big, diverse, large state. And so we are working very intently now. We're ramping up all of our media pushes and our interviews and our town halls, really trying to show people the data that this vaccination and the lack of it is tied to this surge and this increase of individuals going into the hospital with COVID. And as Dr. Arwady mentioned, for Chicago, we saw that for the Metro East area, 100% of the deaths that were attributed to COVID were in people who were not fully vaccinated for the entire month of June, for all the deaths that were seen. So that's very powerful data to remind people that vaccination absolutely saves lives.
And so sad to know that those deaths could have been preventable as well. Let's switch the conversation over to nursing homes. How well are we doing in these facilities now? We know that the highest rate of infections and deaths had been in nursing homes, not only in Illinois, but across the country as well. And if residents of nursing homes, are they fully vaccinated now? And does the Delta variant, pose an additional risk to those individuals in any way? Dr. Ezike?
Yeah, sure. Like in November 2020, that was just the absolute worst month in terms of cases in the long-term care facilities. I think at our highest, there were like 3,500 cases in long-term care facilities in a single day. And of course, we followed the CDC guidance and concentrated for the first amount of vaccines that we got. We gave it to our healthcare workers and our long-term care residents and staff. And so we saw the numbers with vaccination decrease. Last week, Friday, we had 50 total cases across long-term care. So we did the right thing. We vaccinated the most vulnerable. We still have some staff. We still have a way to go with increasing the staff numbers across the nation. 95% of physicians have been vaccinated, but some of the other individuals that work in long-term care facilities don't have that high vaccination rate. So we're still encouraging the staff who have not been vaccinated. And of course, as new residents come into the into the facilities, we want to make sure that they're vaccinated. But we have definitely seen vaccination turn the story around completely in terms of long-term care and COVID.
The reports I've read about unvaccinated staff could be as high as 50% across the country. Do you think that's the same in Illinois? And if, at any percentage, what's the hesitancy here? And what do we do to help these individuals understand the urgency for themselves, their families, and those they're caring for?
Yeah, so it's, again, everything is varied. Nothing is a one size fits all in our big diverse state. You have some facilities where it is 50%, maybe some have gotten to 60, and then you have some where it might be significantly under that 50%. So we continue to push. There have been, raffles and incentives trying to get the employees working in the long-term care facilities to get the right information and hopefully choose to be vaccinated. I know some systems are moving towards mandating it for staff, but it really is going to take, as it has been for this entire COVID journey, this all-in approach. Anyone who knows someone who works in those facilities, have that conversation. Talk about, why someone may or may not. For some, there may be ongoing concerns. Maybe they haven't had that talk with their doctor. Maybe they have seen some of the the misinformation that has been circulating widely on social media, and maybe that has formed some of their opinion. And so we're trying to chase down and counter those myths and supplant it with the truth. But some of those very salacious, fantastical stories spread faster and farther than the truth. So we're encouraging people to talk to trusted healthcare providers, use credible sources, so that we can do the best thing for that vulnerable population in the long-term care facilities.
And that's a big reason why AARP, we're talking to you today about that, to help to move that needle. Dr. Hardy?
Yeah, I would add to that that there is a big range, of course, in what we see. We do have somewhat higher, overall vaccination rates in this setting. But what is really interesting to me about settings that have been hardest hit by COVID, whether that's the long-term care facilities, whether that's some of the first responders, et cetera, we hear a lot, because we do focus groups, there's a lot of work that has been done and continues to be done to encourage vaccination in these settings, is that people who have seen it a lot up close either say, I already got COVID and I don't want to, quote, take my chances again with the vaccine, or they say, I've made it this far in a risky setting, I'm probably protected myself. And the thing is, neither of those turn out to be really very true. It is true that when someone has had COVID, they have some level of protection, for sure. But unfortunately, we do see people getting reinfected, particularly as variants are coming out. There is some more potential, and there's a very strong recommendation in terms of having a predictable and more long-lasting protection to get the vaccine. But I do think in this population, I really want to give thanks to everybody who has worked in nursing homes over the last 15, 16 months, because it has been such a hard space and people have been trying so hard. But I think it's misinformation in some cases, but it also is this sort of fatalistic sense. And I really want to emphasize that the vaccine, you look at the data of how, as vaccines went into long-term care, is what we call the epi curve of how cases went. It just went down, and it's beautiful. But we do still see people getting infected, right? Including some people who are vaccinated, because we do not have 100% protective vaccine. There's no such thing. And although the vaccine is very good at helping keep people out of the hospital, keeping them from dying, in settings like long-term care, where you often have people who are so vulnerable at baseline, it's of particular concern. So we have certainly congratulated some of our facilities here that have vaccination rates and staff, up over 90%. And I feel strongly that, really healthcare workers working in vulnerable settings do need to be vaccinated. But I think there's a little bit of a different conversation because of the experience that they've had.
Okay. With that, Dr. Hardy, beyond the healthcare workers, Are there other groups of individuals who have shied away from getting vaccinated? And is there something you can share and we can share with them to help them reconsider and to go ahead and do get vaccinated?
Yeah, so if we look at some of the patterns here in Chicago, and they're broadly reflected across the state and the country, certainly age plays a role. So we see younger Chicagoans, Illinoisans less likely to be vaccinated. And so, and that's true certainly among adolescents, but even among that 18 to 34-year-old group, we still are, quite vaccinated, but we lag a lot. And that's kind of what helps pull us down as a city. And so I always like to remind folks that as early on, so many of the people who were being hospitalized or dying were all in this older category. We look back just over the last month or so, more than a third of the people being hospitalized, are under 40 here in Chicago with COVID. And that's just different because of the vaccine pattern. I want to be really straight with people that it is true that folks who are younger are less likely to have those severe outcomes. That said, there are plenty of people who are younger who do get sick and sometimes has to be hospitalized. And the vaccine, I think people have this idea that they're very worried about the side effects of the vaccine, but the side effects of the vaccine are nothing, compared to the potential side effects of COVID. And the other piece that I would say is where we look at both race and ethnicity as well as sort of income patterns. We see people who are lower income and also who are more likely to be Black or Latinx, less likely to be vaccinated. And so we can have some more conversation about that, but a lot of work with making sure that there are trusted community members who are carrying messages. We're literally going door to door in some communities and offering people the opportunity to get vaccinated right there. And we've made here in Chicago, anybody over the age of 12 can call 312-746-4835 and we'll bring a vaccine to your house and try to get rid of every barrier. And that's been very popular. So it's about getting rid of barriers, getting the right information out, and then having really honest conversations about why because when people are hesitant, they're trying to make a decision they believe is good for their health. So I want to support that while trying to make sure that the information that they're getting is based in the data.
Yeah, as far as the after effects of the vaccine, I know it's different for everyone. I can thankfully report that after I took my shot, I had a longer than usual Saturday afternoon nap, and that was about it. So let's talk about the honor system as it's being referred to. As we're now feeling a little more comfortable being out and about. I know I have to say I'm confused about this too. So I go to the grocery store and I am vaccinated, but the person next to me is not wearing their mask, so I should assume they're vaccinated too. And making decisions on masks based on the honor system seems a bit, risky and confusing, because even if I do decide to wear a mask, people are going to look at me to wonder if I'm vaccinated, even though I am. So does the Delta variant, mean we should be rethinking this unmasking guidelines that help me with this, somebody?
No, personally, I do not have a hate relationship with my mask. I know that it does good things, and it was what we had before the vaccines were here. So I definitely respect and appreciate the mask. And like you said, this honor system, you can't assume. I definitely, when I go to church and there's lots of people there, when I go to large indoor gatherings, parties, I feel more comfortable wearing a mask. But I know there are many fully vaccinated people who don't wear, but I also know that there are people who have not been vaccinated, have no plans of being vaccinated, who also don't wear a mask. So you really can't tell anything by the mask being worn or not worn. So you just have to take each situation, assess your own risk tolerance, and determine your love-hate relationship with your mask to determine, what's best for you. But we shouldn't mask shame people. If someone wants to wear their mask, please allow them to do that, and respect people's choices.
And I would just add to the question about sort of how the Delta variant figures into this. It's not so much the Delta variant as it is what does the risk become in a community that may be the result of the Delta variant being there. So the reason LA made that decision is because with the kind of numbers that they're seeing, first of all, they're just worried that as people are gathering, when you're having more than 1,000 cases a day, the chances of you running into somebody with COVID goes way up. And whether or not you are vaccinated, there's some risk there, but especially knowing that there are people who are unvaccinated but unmasked, they then make the decision to say, we're just going to have everybody masking it. That's not where we are right now, right here. And I'm not concerned, where I look ahead, unless we get a variant that really the vaccines are not protective against, or there's some other major mutation down the line. I'm not worried about overwhelming our health system in the way that I was. I'm not worried about having to do the major sort of shutdowns and lockdowns because we have effective vaccine. But I am worried about the individuals who choose not to take advantage of that, who, will have some surge and will have some stress. So we think about the risk in a little bit more, there's sort of an individual risk separate from the risk at the city. And so, if we got to a point where we were also very, very, having a lot of cases and the risk was higher, much, like dramatically higher for people who are unvaccinated, and then even somewhat higher for people who are vaccinated, although they're largely protected against the serious outcomes, that might be a decision that we make. But I don't want to just say, start wearing your mask. I want to save that for a time that we might really need it. Like if there's a variant that truly we have to revaccinate everybody, we are not there, I'm not anticipating it soon, we would have to move back to, all of that masking and be really, really serious about it. So we're conscious as we're making these recommendations about wanting to make sure that when we as public health professionals are setting, especially requirements for a population, they are clearly based in the science, the data, and the risk at the population level. Plus, and then on the individual level, I default to having my mask on until I get into a situation and sort of, is everybody vaccinated? What's the scenario? And sort of go from there. And, it doesn't bother me particularly, to wear the mask. So I think it's a little bit of that individual setting.
Yeah, I have to admit that I got so used to wearing a mask on one Zoom call, I started putting it on.
Right.
So let's talk about the Centers for Disease Control, also known as the CDC. They put forth all kinds of policies. I get their emails. States make the decisions. And after that, it sort of goes down from there to counties and municipalities as how that information goes out. Talk to us about the Centers for Disease Control, and how do you make decisions, Dr. Ezike and Artie, at the city based on policies and guidance they put forth? Sometimes the guidance seems clear, other times it seems a little ambiguous and subject to guessing. Would you like to, Dr. Awadi?
Oh.
Or Dr. Go ahead.
Either way, I'll start with it and pick it up.
Yeah, go ahead.
Yeah, so, the CDC is the organizing public health, agency in our country. And the CDC provides the huge bulk of the funding also for public health activities at the state and at the city level. And so we have long had a very close relationship with the CDC. I had training at the CDC. I very much trust their scientists. I trust their methods, et cetera. I do think, during this pandemic, just how political many things have become. We have also seen that reflected, unfortunately, I think, in the way the CDC has been perceived and treated. And that's something I'm worried about, because a strong public health system, it's not enough to have a strong city or a strong state, like actually having a strong national health system where we're thinking about things like variant surveillance and we're thinking about, having some policies is important. I think it's very typical, actually, for the CDC to release guidance like it has done. If you look at this most recent schools guidance, they say, here's what we know based on the science, right? Kids should be back in school. And here are some broad recommendations around it. But then they really say it is at some level a local or a state, but I think in this case, they actually said a local decision, because the risk is going to be different based on that disease sort of in that population. So, we I talk to the CDC a lot, and I am conscious of the need. The CDC has been underfunded, just like state and local health departments have, and the need to really build up what I think is some very, very good, long decades of expertise there. Make sure that they've got some of the resources, and then ensure that the guidance, but also the science behind the guidance, is sort of being released and being supported. But it's been a rough year for them, for sure.
Sure, Dr. Zike, how do you turn those recommendations into policy at the state level?
Yeah, so, we do look to them as one of the world's premier public health agencies. We have, world-renowned scientists at the CDC and always have, and they have the benefit of being able to amass, all the information and data from across the country to be able to see, have that bird's eye view of what's happening. And so with all of that intel, they are able to help put out guidance. But again, such a big state, such a varied country with different needs in different states, we do at the state level look at the guidance, and then if necessary, we might need to make minor adjustments to what we will do to make it fully relevant, to the state of Illinois. For one, a good example is that initially the advisory committee to the CDC on immunization practices said that we should start with vaccinating individuals 75 and over. And at the state level, we made the decision that it would be 65 and over, and it actually became a recommendation later from the federal level to make it 65 and over. So small tweaks like that might be something that you might see from the state, from the national to state to local. Local can even, do more tweaks to it, but you're not going to see wide variation. You're not going to see big spread on important matters. There might just be tweaks on the edges. Okay,
so just a few more questions, if you will. What do you see when you're looking, gazing into your crystal ball and your expertise? Things like children under the age of 12 being vaccinated. We talked a little bit about, I don't think we called it booster shots, but we hear about that as well. And anything else that you think is on the near horizon as far as this pandemic's concerned?
So definitely in terms of the little ones, there are many parents and school administrators that would love to hear news coming soon about childhood vaccinations for COVID. So we don't have anything that we're expecting this summer. We are thinking that we should see something in the winter, at least for one manufacturer. And then we know that another manufacturer is in the midst of their trials for the children as we speak. And so that will come. But in terms of protecting our children, we know that the best thing we can do right now is create this cocoon, if you will, by having all the adults and all the people 12 and over around those children to get vaccinated, to protect them in that way. In terms of boosters, we are working with the CDC. Again, we have maybe a dozen different calls with the CDC per week to get the latest updates. We know that Pfizer, Moderna, Johnson & Johnson, they have ongoing trials trying to look at, I know that they have created, updated versions of the vaccine to see in case the current vaccines seem to not be working against, new strains. They have updated ones, but at this point, there's no indication that that's necessary. But our science teams in our pharma companies are working diligently, conducting those studies and researching so that no matter what new twist comes our way, we will be ready. But no indication at this point for the need for our boosters. Continue to follow the data. That's not a promise forever and ever. That's where we are at this moment in time. Continue to follow the data to see if that answer changes.
Yeah,
Right.
and I would just add to that, you know, it's been amazing to see the entire scientific community across the world really working on this at some level. And it's part of why, you know, sometimes we get the question, well, how did this vaccine come so quickly, right? That it has been such a global effort to try to figure out what we can do about this, you know, not just as a city, but like at the population level. And so when I think ahead, you know, every week, like you should, you know, the medical journals, the science journals, the epidemiologic data, like it's full of all of this really important data and science that is continuing as we try to look ahead. And so like on the question of boosters, for example, there's no booster recommended right now. And I don't think, you know, again, unless we get a variant that emerges that really the vaccines are not protective against, I don't think this is something on the short-term horizon. However, there's been some data that suggests that, you know, perhaps in people who are at the very oldest end of the spectrum, or maybe people in long-term care facilities, or maybe people with certain immunocompromising conditions or on certain medications that decrease the immune system, could there be a recommendation? And that would not be dissimilar from what we do for flu shots or what we do for some other shots. Like we identify populations that may be at greater risk and there might be a booster or there might be another piece. So that may be something that we see coming down the line. Of course, protecting our most vulnerable folks remains like absolutely front and center in what we're thinking. But by far the most important thing is getting more folks to get really that first dose of vaccine. And I think kids, we don't know exactly the timeline, but school age, looking like maybe in the October range, right? We'll see. We're doing a lot of planning for it already. And then maybe the youngest kids sometime around the end of the year, beginning of next year. But again, they're waiting for all of the safety, all of the efficacy, and all of the dosing data, because you can't actually speed these process up, you know, faster than the science goes. And the end of July is when COVID vaccine trials started a year ago. And so we are just starting to have, you know, a whole year of safety information, and it looks great. Like, boy, like we got so lucky here. These vaccines work better than I anticipated that they would, honestly. And to have a safe and effective vaccine that's been given billions of times around the world, and we've seen such good protection from it, is truly remarkable. So more to come, but the science very much is continuing and needs to continue, you know, and we'll take lessons from COVID to other diseases and other, you know, health issues, of course.
So speaking of an entire year of having a vaccine available, or at least from the beginning to the point we have now, there's this odd term called herd immunity, which I never thought would be applied to humans, to be honest with you. And it's apparently somewhat conceptual. I think it was Sweden who wanted to go in that direction as far as addressing the virus, but it didn't help them very much. And the president had talked about trying to get 75%, I believe, of the country vaccinated to get to that idea of talk about herd immunity. Is it viable? Is it any way we get there at this point, you know, considering that the virus is even mutating now?
So, I mean, I would just quickly on that say there's no magic number. There never has been a magic number, because as diseases get more contagious, you know, herd immunity just basically means, is enough of the population, quote, the herd, protected, that if one person is diagnosed with a disease, is it going to spread significantly, right? And so if you have a version of COVID that's not very infectious, like it turns out the original one was plenty infectious, but it's getting worse, you know, you wouldn't need to vaccinate as much of the population. As it's getting more and more contagious, you would need to vaccinate more of the population for the population to have that protection. But this concept is actually really important, because it's the difference between risk. If you're in a setting that is highly protected to an extent through natural immunity, especially through vaccine, the risk is lower even for the people who have chosen to be vaccinated, right? And that's what it's important for people to understand this. It's like my decision to get vaccinated is not just about me. It's about the whole community and protecting all of us against, you know, variants and whatever is coming, and contributing to the fact, you know, like measles, we have measles cases, but when measles cases are diagnosed, and measles is even more contagious than COVID is, we quickly dive in there and do a whole contact tracing, but the great majority of Americans are vaccinated vaccinated against measles. And so we don't see it spread unless there are kids under 1 or, people from other countries or whatever it may be. And getting to that point, we're not there from COVID. And it's why we're going to, keep doing this probably for some time to come.
Dr. Ezike, sounds like the odds are in someone's favor the more individuals who are vaccinated. Is that another way of saying it?
That's a wonderful way to say it, that we all benefit from every individual who gets vaccinated. And it helps you, it helps your family, it helps your community, it helps the herd. And so every dose matters. And even if you think, I'm so low risk, I think I could take my chances with COVID and win, you still want to get the vaccine because of the people who are 10 years old and maybe have severe asthma who can't protect themselves. So it's really an all-in approach to getting to taking advantage of this herd immunity, and is why everyone should consider strongly getting this vaccine if they haven't already.
Maybe we should start telling people to increase their odds instead. So vaccinations obviously are still happening and available across the city and the state. So Dr. Ezike, how can people get a vaccine, and information you can share about the new at-home program that would be available at the state level as well, and also at the city?
So it's hard to miss a vaccine opportunity, really. I mean, you're almost tripping over vaccine clinics happening in the park, at local county festivals, at fairs. It's clearly at all the pharmacies, whether Walgreens, Albertsons, CVS, Hy-Vee, Jewel Osco. You can get it from your healthcare provider. You can go to your local health department. But if somehow you miss all of those, you can call the state's toll-free vaccination appointment hotline, and they can help you find their location. And that number is 833-621-1284. I'm just going to say it one more time, 833-621-1284. Remember, these vaccines are completely free, no cost to you, and there really are locations absolutely everywhere.
And specifically in the city of Chicago, the at-home program for Chicago residents is 312-746-4835. And if you call that number, there's hundreds of people, there's not a long wait on the phone, who are there to solve whatever your vaccine problem is. So you want to know where to get a particular vaccine, a second dose, you got one dose out of state and you want to know what happens, or you want to sign up for at-home vaccination. I will tell you, we are still doing about 4,000 vaccinations every day just in the city of Chicago. And our at-home program has been very popular. We're about 98% booked. We're adding additional appointments. And so as we continue to see demand, there are still plenty of people out there still making the decision at this point. I think I'm hopeful that there will some people who hear, it's been a year since the vaccine trials started and things still look good for those people. Some of the wait and see folks may say, you know what, now's the time. And I think there may be people worried about the Delta variant. I'm a little worried about the Delta variant myself, who may make that decision. So call and we will make it as easy as possible here in Chicago. There's also a Grubhub gift card because we encourage people to get together with your friends, your family, your neighbors. We'll do 10 vaccines on the spot at your convenience, Pfizer or J&J, and that's available for anybody age 12 and up in the whole city of Chicago.
Okay, I can't make any excuses now, right? All right, for our last topic of the day, we hear about folks who have had COVID and being what are referred to as long haulers with various complications. And what is COVID going to continue to do, to our healthcare system overall going forward? And perhaps there are other dormant viruses out there somewhere hiding. So how do we take what we have learned from COVID and apply it to a possible another public health crisis or emergency? So, first the long haulers, and then how that's going to affect our public health systems going forward, and how do we stay prepared for the next time?
Yeah, that's a really important question. And, the COVID long haulers, again, just for people, they're people who maybe had a very mild illness, maybe had very minimal symptoms, but then have gone on to have lingering symptoms that maybe even were different from the first mild symptoms. I've run into people who've said that they've continued to have a loss of taste or smell going on 4 or 5 months. There are people who are applying for disability benefits because they can't hold their job anymore. They can't focus. They call it this COVID fog, where they just cannot concentrate, cannot hold on to their thoughts. So now are unable to be successful at work. There are some people who have some chronic aches and pains. So when people think about, oh, I'm so concerned about the long-term effects of the vaccine, you really need to be concerned about the long-term effects of COVID and what it can do. And so we have yet to see what this will mean. Different hospital systems are creating like a COVID long haulers clinic because they're just growing numbers of people who recovered from the initial COVID, but are seeking ongoing care for these chronic symptoms that have persisted for months and months and months. And we don't know what that is going to portend. So very important issue that you can prevent that as well by getting that COVID vaccination. And then in terms of just, thinking about what can we learn from COVID as we look, hopefully not anytime soon, for another major crisis like this, but we know it will happen again, and it may not be 100 years. We need to think very intentionally about how we educate the masses about very important topics such as vaccinology, about vaccines. I think vaccines somehow do themselves in by being so effective that people don't appreciate them. The reason that we don't have children, jump roping and they have braces on their lower extremities is because you don't have tons of kids getting polio and having the debilitating effects of polio. We don't see, tons of measles unless somehow you didn't want to get vaccinated as a choice. But our vaccines are so effective. They're one of the greatest medical advances of the last century. And so making sure that people understand them, understand how many diseases that they have controlled, how many lives it saved, might help us if there should be something similar to this coronavirus pandemic, so that people will be more willing to take advantage of this precious life-saving resource that people around the world are begging to take advantage of.
Yeah, and I would add to that, on the long hauler front, one of the things, this is an area where we have learned a lot about immunology, immune systems, right, as a result of COVID, again, with so many scientists working on it. And I think it's one of the spaces that continues to have a lot of focus. There are a lot of unanswered questions there, way more unanswered questions about COVID long haul than about the COVID vaccine, I will say for sure. But I do think one of the most interesting things, I had someone come up to me just a couple of days ago who had been one of these COVID long haulers, like 6 months, really not well. And then there's been this interesting thing where people who have long haulers who have gotten vaccinated in some cases have actually seen significant improvements, like in their, in their symptoms. And she wanted to tell me about this because she's like, thank God I can finally be back at work. I can be doing this. But there's a lot we don't fully understand about what when someone gets infected and you sort of have this low level, inflammatory immune response that somehow you can finish off. So we'll be learning more about that. But there are absolutely lots of folks here in Chicago and in Illinois, unfortunately, dealing with long-term, and young people too. And in terms of the preparedness and sort of thinking about what do we need to do differently, where do we need to be looking ahead? So I will say, in Chicago, we really take public health emergency preparedness very, very seriously, and had done a lot of exercises, actually had a lot more physical materials on hand than it turned out a lot of other cities or the states or even the federal government did, in terms of, we had millions of N95 masks that were like that had been properly held and were ready to go. We had a lot of the things, not for every, like in terms of being able to start, but for me, this has really helped us think a lot about the preparedness piece that needs to be funded, right? Like we tend to think about funding related to a disease, right? Like the COVID is the first time in a very long time that as a public health system, we actually feel like we have the funding to be able to do what needs to be done to address it. My worry is that if you only have that funding to address COVID, you can't actually build the structures that let you have the surveillance and be looking for variants and be doing the lab work and be doing the community-based work that turns out to be critical to this. So we're thinking as much about the human infrastructure preparedness piece as we are the stuff piece, and making sure that you're funding and supporting sort of one of the reasons I'm, in Chicago, I think a lot of our vaccine work has gone quite well because we've been really integrated with community-based providers, community-based organizations. And I don't want to just do that with COVID. I want that network working on the chronic disease issues that, have long been causes of the racial life expectancy gap, that are working on thinking about healthcare access and building a much better system so that no matter what comes next, we can hit it much more easily and we're not starting from scratch again.
That's great. Thank you, Dr. Ezike and Dr. Arwady, for sharing your brilliance and advice and vast experience in public health, particularly at this time. I'd just like to offer any closing comments that you both might have, starting with Dr. Ezike.
Well, just thank you so much for this invitation to talk with your Facebook audience. And I'm hoping that some people who hear this, who maybe decided that they didn't need the vaccine, that they thought their chances were good, are moved by the opportunity to support their community, even if it's not about protecting themselves, that they want to make school more safe for the kids who will be going to school in just a few weeks. And so that they'll go and get that vaccine to get us closer to a herd type immunity setting. So please get vaccinated today, and maybe you'll be rewarded by one of the $7 million in prizes and scholarships that are available to anyone who gets that initial dose. Their name will be entered into the lottery for these $100,000 prizes, the $1 million prizes, and the $150,000 college scholarships for those under the age of 18. And if you don't want it, that can be passed on, but it is just another thing to encourage and thank people who have done this important work to help us try to put COVID in the rearview mirror.
Thank you. Dr. Arwady.
Yeah, thanks again for the conversation. I always welcome the opportunity to just talk frankly about some of what we've learned, some of what we're still learning. And I think, on the vaccine front, I would also encourage people who have made the decision to get vaccinated to talk to their friends, their neighbors, their families about it. I know those can be difficult conversations, but we see from the data, many people trust if they have a primary care provider. So talking to your doctor, please, if you have questions about how your condition, whether vaccine would be recommended would be one, but also for people who have made that decision. We see a lot of people being swayed by conversations with families and friends, and especially if you're someone who was nervous about it or was hesitant about it. This thought of sort of why you did go ahead and do it, I think is important. We like people to have questions, but we want people to make sure when they're getting those questions answered, they're getting them answered from a trusted source, like a doctor or a public health agency, or if there's a particular disease you're interested in, go to that disease's webpage, the official society that works on it. And you will see COVID vaccine recommended, broadly everywhere, but a lot of specific questions answered. So keep the questions coming, keep talking about this. And every person who gets vaccinated makes that likely surge that is coming with Delta in the fall, makes it a little bit lower for everybody and helps us put this even more behind us.
Wonderful. Thank you both so very, very much for sharing your valuable time and your insights on this very important topic. You truly are both heroes during the last year or so and getting us to where we are. And you both deserve a rest, I hope.
Thank you. So do our teams.
Yeah, I'm sure they do. I'm sure they do. Thank you very much.
Thank you
so much.
Yep.
Pleasure.
Folks, in the face of this crisis, AARP is providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others while taking care of themselves. For more information about the coronavirus in Illinois, you can go to dph.org. vaccine.illinois.gov/COVID-19. To register for the COVID-19 vaccine, feel free to call the state of Illinois COVID-19 vaccine appointment hotline at 1-833-621-1284. Again, the Illinois COVID-19 vaccine appointment hotline is 1-833-621-1284. And as you heard from our guest, there's plenty of opportunities in your daily travels to get the vaccine in so many different locations. However, for the city of Chicago residents, you can go to chi.gov, that's chi.gov/COVID-vax, that's COVID-VAX, or call 312-746-4835. Again, that's 312-746-4835. Finally, ARP Illinois is all helping us to spread the word that people ages 50 to 64 could potentially save money on health insurance through the new Affordable Care Act special enrollment period. Because of changes in the law, you could now pay as little as $0 for your premiums, or you could save up to thousands of dollars a year. To learn more, call us at 1-888-OUR-AARP. That's 1-888-OUR-AARP, or visit aarp.org/ACA. Thank you all for participating in the discussion on this important topic again. And a special thanks to you, the Chicago Sun-Times. Thank you all for listening and tuning in. Have a wonderful, safe, and healthy day.